Yes.
Welcome back to Good Morning San Diego. Lawmakers have reached an initial deal to expand the GI educational bill.
The bill builds on legislation first introduced in 2008 that guaranteed a full-ride scholarship to any in-state public university. It would remove, this new bill would remove a 15-year time limit to tap those benefits and boost money for thousands in the National Guard and the reserves. It would also make all Purple Heart recipients eligible for full GI Bill benefits. Sounds like a no-brainer,
yeah,
right?
So what does this all mean? We invited
right?
Our Representative Scott Peters here this morning to talk about this. Good morning. Nice to have you here, Congressman.
Good morning.
It'll be introduced after the words no-brainer. Thank you very much.
Right, no-brainer. But that you were one of the initial sponsors of this bill. How in the world would Purple Heart recipients not be eligible for full GI benefits? I don't understand that.
Right. Well, so, you know, obviously when people sign up to defend our country, we make a deal with them. One of the deals we make with them is you'll get GI Bill benefits to help you with a college education or technical training after you're out. What we found out was that if you're, you have to make 36 months to get the full benefits. Well, imagine if you're on the battlefield, you win a Purple Heart, you don't make the 36 months, you weren't getting your full benefits. So I introduced the bill on that particular point that said, listen, we think it's reasonable that you have a 36-month, 3-year service requirement, but if you've been injured defending your country on the field of battle, you've met the service requirement. You deserve full benefits. And that will be part of the Forever GI Bill, the modernization that's going to hit the House floor next week, and I think it's going to be adopted by the Senate pretty soon.
I wonder what the thinking was behind that originally. Maybe it was because there was the wars were bigger, there were more numbers, and it was more costly? Or what was the reason for that?
I think it's one of these things that people didn't you know, like all of a sudden, well, you know, we understand 36 months, but someone who get injured wasn't getting covered. So we noticed that. It's a few hundred people a year.
That's what I was going to say. It's not, this isn't an abstract idea. These are hundreds of veterans that you're talking about.
And so we just want to make sure that we're, and I think San Diegans understand this as well as anybody. Let's honor our commitment to those folks who fought for us and the ones who've actually been injured in the course of defending us.
Let's talk about the other other thing that this bill does, which is end the 15-year requirement. What does that mean?
So under the current law, you have 15 years to use your benefit after you're discharged, and so you might come out of the military with particular skills, take a job, and not realize till later that you want to increase your skills, get a college education, get technical training. But there's a 15-year limit. Well, for new enlistees, we're going to remove that limit. We're also taking care of people who might have been being educated at one of those schools like ITT Tech that failed.
And closed down on
closed
them, right?
down, and now this wasn't their fault. We're going to restore the benefits to those men and women so that they can continue their education at a place that's still going.
Commitment to veterans is something that I think is really near and dear to San Diego, and the message from Congress has been, at least recently, that we will take care of our veterans. We will help you with your lives, because we see, especially with our homeless veterans who are suffering so much, they really do need our assistance.
Right. And I'll tell you, too, that one of the great pleasures of my service in Congress has been my assignment this term to the Veterans Committee, where you have true bipartisanship. We have a chairman and a ranking Democratic member who work together beautifully. They work out problems. We're working with the veteran service organizations to make sure that they have input. We're working with the Senate side, so we're not doing two different bills. So this particular bill, this GI modernization bill, the Senate's going to pass exactly the same bill, and it's going to become law. It's going to be easy for the president to sign it. It's the way it should work. I think we're setting an example of Congress on things like health care and tax reform. But we're doing it because I think the country's really committed to taking care of our vets.
I really want to, before we move on to another topic, I want to just address the National Guardsmen and the reserves that will also benefit from this bill.
Right. We want to provide parity for those folks, too, who also, their service is very important. We want to make sure they have access to these benefits as well for training. It's one of the things we can offer people in an all-volunteer Army to sign up and help defend the country.
Let's talk a little bit about what's going on in Congress right now with health care reform, because this is something that the House worked out a bill that sent it off to the Senate. The Senate made a mess of it. What now?
Well, here's an example of what not to do. The House did something the Senate wasn't interested in, and the unfortunately the Senate can't seem to get its act together. I opposed all those efforts because they're very unpopular. They're bad policy. A lot of people are going to lose coverage. So I would say now's not the time for the Republicans to double down. Now's not the time for the Democrats to high-five. I helped convene a group of like-minded Democrats to fix the things that aren't working, because there are some things that aren't working. And we're now engaging Republicans this week to see if we can't come up with a solution from the center to fix some of the problems in the individual market, which is the real problem that we're having right now. You know, if leadership will let us, we can help solve some of these problems without all the political rhetoric that I think's driven the policy so far.
How do we get there? I mean, how do we get to the, I mean, what you're saying sounds reasonable to me. I think it would sound reasonable to the people that are watching right now. How do we get to the leadership so politicizing such a thing that we all need, which is health care?
Well, you know, it comes from the top. We have, unfortunately, we have, you know, whatever you think of Mr. Trump's policies, I'm not a fan of his policies, but it's pretty chaotic down at the end of the street. Just there's, you know, he's trying to run the federal government like a living room real estate investment business, and it's so that doesn't help. But in the leadership of the Congress right now, you have people, you know, Mr. Ryan's decided what he wanted to do with health care. He decided what he wanted to do with tax reform. We need to have hearings. We need to talk to the economy. We need to talk to providers. We need to talk to patients and doctors about what really has to happen. Let's get that information and form policy around that. That's what's worked in the past in a bipartisan way, and we should do that in the future.
You know, when we've had Congressman Darrell Issa here, he has said the exact same thing you did, which is, I have ideas to fix this problem, and I have reached across the aisle. Are you willing to work with people like, I know you guys work together all the time.
You know, so Darrell and I have a good working relationship, and we haven't engaged in healthcare, but I proposed 3 particular fixes to fix the individual markets. You know, to get induce younger people in, which drives premiums down, provide more certainty in the subsidies we provide for people who can't afford, so that insurance companies know they can count on that, providers know they can count on that. That drives premiums down. And to make sure that we're giving a backstop for those really few high-cost cases that if you don't provide particular relief for, drives everyone's premiums up. We want to keep premiums down. I've got particular ideas about that. I think we're going to get some Democrats and Republicans to sign up for that, and we hope it'll get some traction with the leadership.
Now, see, maybe this crisis can be averted that we're facing right now. Scott Peters, thanks so much for being here with us this morning.
My pleasure, thanks.
And enjoy, real quick, Comic-Con. I know you're going to Comic-Con, speaking of Congressman Issa, right?
I'm taking on Congressman Issa in a video game tomorrow.
And where is this happening? Do you know?
Oh, the Entertainment Software Association is putting it on, so I will show up somewhere
and play video games.
And battle.
Very
you
nice.
do know that Issa's kind of a techie, right?
I'm aware of that.
All right, Congressman Scott
Got a couple of years on him, though.
Right, that's a good point.
Great to have you here. Thanks.